to the daily press briefing from the Unified Emergency Operations Center of Milwaukee County. Today, we're going to focus on racial disparities and COVID-19. We have a pretty full lineup this afternoon. I'm just going to run through who our speakers are. First, we'll hear from County Executive Chris Abele. Then we'll hear from Milwaukee Mayor Tom Barrett. Then Director of Medical Services for Milwaukee County, Dr. Ben Weston. Then Dr. Jeanette Kowalik from the City of Milwaukee Health Department. And a note for press on spelling of Dr. Kowalik's name, that was incorrect in the advisory. It's one N and two T's. After Dr. Kowalik, we'll hear from Dr. Jesse Ehrenfeld, who's the director of the Advancing a Healthier Wisconsin initiative. After that, we'll hear from Reggie Jackson, head griot of America's Black Holocaust Museum. Then Nicole Brookshire, director of Milwaukee County Office on African American Affairs. Dr. Tito Izzard, president and chief executive officer of Milwaukee Health Services. Supervisor Felicia Martin, representing Milwaukee County's 7th district on the Board of Supervisors. And closing it out with Wanda Montgomery, who is the president of the Brown Deer Village Board. So with that, County Executive Abele.
You bet. Great. Well, thank you everybody for being here. I will start, we'll start and finish as we always do, reminding everybody to stay home, save lives. The numbers continue to increase, and as always, the single best way we can save as many lives as possible is stay diligent about that instruction, and it's simple. Again, today the numbers are large. It's 1,634 confirmed cases now, 75 confirmed deaths. And again, as we've been talking about for some time, of the confirmed cases, 732 are African American, and of the 75 deaths, 50 are African American. And to put that in context, Milwaukee County's population, African Americans make up about 26%. So the fact that well over half, the majority of the deaths are African Americans, and about half of the known cases is, as we've said many times, a stark illustration of what we have talked about a lot, but as I guess to sum up what I want to say today, we need to do more than just flag this. When the county put together this dashboard that we share every day, we have always, from the beginning, also shared the data on ethnicity and demographics. Because there's such an incredibly disproportionate impact on the African American community, we've also included right on the front page the bar charts by ethnicity, so you can see just how stark that differential is. Again, as I've also said, there's a straight line between why that is the case, why the county declared racism as a public health crisis. Long before coronavirus, the average white male in Milwaukee County lives many years longer, average longevity, than the average African American male, even when you control for income, education, employment. You all know that in this latest election, not surprisingly, the group that was probably the most underrepresented because of the complexity and the difficulty of filling out absentee ballot forms were African Americans. If you look at the percentage of returned ballots, the percentage of requested ballots, you can see that. And as everybody on this call who was trying to stop this election from happening knows, this wasn't because we don't care about democracy, it's because we care about saving human lives. The fact that on the day of the election, you saw more crowding on MCTS and the bus, well, people should be very clear that not everybody has a car to get to a much reduced number of polling places, which puts the people who don't at more risk. Not everybody has the option of being able to easily telecommute or staying at home. And for a lot of people, staying at home isn't as much of an advantage as it should be. We often gloss over this in this community. But if we can't take what is the most tragic and bold-faced illustration of how far behind this community is for the African American community as a mandate to not just flag it, but to do something, then we haven't learned anything. I'm incredibly excited that we have a session today entirely on this subject. And I urge the press, please stay on with this and please cover this. Please help us make sure that as a community, we don't just gloss over this issue. So with that, I will turn it over to Mayor Barrett.
Thank you, County Executive. When I first looked at the daily graphs that came out, this is now some 2-3 weeks ago, with the blue circles as to where the concentration was, it immediately, and I mean immediately, jumped out at me that there was a concentration of cases in the northern part of Milwaukee County. And specifically, I will always remember the first big blue circle, which is around 60th and Center and northeast of there. The following days, we saw more large circles covering a good portion of the Sherman Park area. And as the weeks have gone by, we've seen larger and larger circles, which tragically mean that there are more and more cases. You add on to that then the ultimate tragedy, which is the deaths of people. And as the county executive said, 2/3 of the deaths that we are experiencing right now are deaths in the African American community. In the Washington Post, they just did an article about this, about Milwaukee having essentially the highest percentage of deaths coming out of the African American community. And that is something that every person who is with us today is very, very concerned about. We're very, very pleased that our partnership with the Medical College of Wisconsin, and we're pleased to have you here, Dr. Ehrenfeld, and Advancing a Healthier Wisconsin. And I want to congratulate and thank Commissioner Kowalik, because it was her department that put forth this grant to get a $500,000 grant from the Medical College through Advancing a Healthier Wisconsin to make sure that we are reaching people in ways that they will understand, that we understand that we have to get the message across as to how people can be safe so that we don't see more disease and we don't see more death. So this is something that we recognize as a county executive said, we can't just talk about it, that we have to be able to do things. But we also are very mindful that there are social determinants of health that have been in this community literally for decades. And I know that's something that Dr. Izzard has talked to me about. He's talked about it publicly, about the need for economic change as well. And that's a reality, because even now, when you look at the percentage of people who are able to work from home, the percentage of people who can work from home who have a college degree is a much higher percentage. People who have college degrees are much more likely to be able to work from home. It's the people in the service industry, the people that are working in our nursing homes, our hospitals, who are in the lower paid jobs, who are still going to work and putting themselves in harm's way. So we have to be mindful of that, and we have to be committed to take this experience. Right now, we have to get through this storm. We know we have to get through this storm right now, but we know at some point that we're going to be beyond COVID-19, but it is certainly exposing a lot of the vulnerabilities that many of us have known have existed here for many years. So we have a lot of work to do. We've got to get through this storm right now. That's the short-term goal. But we know the economic fallout is very, very hard. And we know the economic fallout is hardest among people at the lower end of the economic ladder. And that includes a lot of people of color. So I want to thank everybody who's committed to this, who understands how important this is to our community. And the fact that we're able to use this grant from the Medical College and team up with the Office of African American Affairs at the county, our health department, the Medical College, we're committed to doing what we can to make sure that we're addressing these problems as quickly and as seriously as we can. So with that, I'm going to turn it over to Dr. Weston, and I want to thank him. He's done so much great work on presenting us with the data, which we all need, and we're all very appreciative of that. Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. I want to be brief and focus the time on our guest speakers today. County Executive ably outlined and our continued upward trend in cases and deaths today. As we've discussed before, 2 in 3 of our deaths are African American while less than 1 in 3 of our county population is African American. Moreover, an African American person who is tested in our community for COVID-19 is more than twice as likely as a white person to have a positive result in that test. While COVID-19 highlights these disparities in our community, we know that they are not new, nor are they isolated. While African Americans suffer the burden of this disease, they also are more likely than whites to die of heart disease, of cancer, of strokes, of diabetes, not to mention violent death from homicide. As simple as it would be to attribute this to individual choices and individual actions, we know that the real causes go well beyond that. The institutional, historic, and ongoing disparities and racism that pervade our community and many communities around the country, the disparities and racial inequity that the county and the city declared a public health crisis nearly a year ago, and the disparities and racial inequity that we have decided, as County Executive Abley pointed out, are important to share on our publicly facing dashboard lead to this burden of disease. And this is what we want to focus on today. And with that, I'll stop and I want to hand it off to First Commissioner Kowalik. Thank you and stay safe.
Thanks, Dr. Weston. Good afternoon, everyone. So I won't spend a lot of time rehashing the statistics. We know that our African American community continues to suffer from COVID-19 and also addressing the underlying issues tied to racism, segregation, and redlining, which I know Reggie Jackson will outline when he provides his update. But first off, I want to thank the Medical College of Wisconsin for this grant funding that we received. The City of Milwaukee, the Office of African American Affairs, and MCW were one of 17 grantees for this Advancing Healthier Wisconsin money that was released to help with our COVID-19 efforts. As you can imagine right now, I mean, we're at the 4-week mark literally today since we had our first case, that there needs to be a huge investment in not only dollars, but also people, creativity, innovation, a willingness to loosen up any red tape that might be present in our organizations. Literally, this is life and death, so we have to make the most of our time. So we're very grateful that we received this funding because it will go towards boosting the outreach. And I know that's something that we've been listening to and getting feedback from many in our community about various messages, the quality of the messages, the realism and the application of the messages. So we want to continue to tailor any outreach initiatives involving community to make sure that they're actually hitting the various segments of our population. We know that there are many, many factors that prohibit or impact our ability to follow a stay-at-home or safer-at-home order. So I just want to outline some of these things very briefly because I know that other speakers today will provide some additional information. But declaring racism as a public health issue as a government entity was the first step. Acknowledging that there's a problem and then working on assessment and analyzing the problem and then getting to training and helping to decondition or deprogram some of our managers and staff that have been working in these systems for a long time. Really setting the tone, what are we about? Where are we trying to go? It's one thing to promote diversity, but it's another thing to create a culture of inclusion where you feel valued and not treated as a token or just one and that's it. We really are working on trying to bolster our diverse workforce, African American, Latinx, Asian, LGBTQ. I mean, pretty much we're looking at what can we do to have a more robust workforce by supporting inclusion efforts. Another point too is the City of Milwaukee recently had hired a diversity recruiter to help with some of these efforts. As we were focusing on rebuilding the health department and trying to look at, okay, who are we reaching out to fill some of these positions, as we've been very intentional about our workforce and making sure that the department represents the communities that we serve because we know that's extremely important. Another point that I want to highlight is related to some of the social determinants of health, or SDOH, that impacts our ability to fully address COVID-19. And it's related to many things like access to healthcare, access to insurance, the quality of insurance. Are you being discriminated against by the color of your skin just by seeking care? underlying health conditions, as Dr. Weston had noted, and looking at China and Italy and using some of that data to prepare us for what we should expect to see here in the United States, how cardiovascular disease, diabetes, and asthma, among many other chronic conditions, how that can cause higher fatality rates among those that are infected with COVID-19. And we know that there's disparities there related to some of these health issues. Also, various substances that are being used to self-medicate and cope, as well as predatory marketing that has occurred in our communities for far too long. So the tobacco smoking, how there is some relationship that is being seen related to COVID-19 morbidity and mortality. Also, the types of jobs that our community are able to hold, and also, like the mayor noted, this being able to telework is a luxury. I mean, many of us here are teleworking right now, but we know that many in our community, whether you're essential for food service, service industry, transportation, and the like, that you don't have the ability to do that type of work from home. You actually have to go out into the elements. So how are you being protected going to work and working and then coming back home and not bringing COVID-19 to your family? Is your employer making sure you're safe by having social distancing, making sure people are 6 feet apart, stepping up cleaning and sanitizing in between shifts and in the workspaces, and then also staggering shifts so that everyone is not congregated at the same time? We know COVID-19 is it's accelerated in congregations, which is why we were promoting this press conference earlier about faith services, since it's Holy Week and there's Passover and today's Good Friday. But just really promoting the need to not congregate, because that's a way for us to protect ourselves from COVID-19 infection. Then also, I just want to talk about some solutions, because we're talking about youth right now. So how do you prevent COVID-19? And we've been talking about washing your hands and social distancing or physical distancing and removing yourself from others if you're under the weather. But just looking forward, here's some ideas that we should consider. So promoting policies to allow lower income people to be able to work from home, or also in making sure that there's better sick pay mechanisms for individuals. I know the federal government has covered that in a way, but we know, depending on the family situation, that people may have, several kids or other people they need to take care of. So having 2 weeks of paid leave may not be enough. Increasing access to quality care, unbiased care. You shouldn't have to go way out to the suburbs to get high quality health care. You should be able to access that in the city. Maximizing Medicaid expansion for COVID-19 testing and treatment. I know oftentimes we say, when people want to know where they can get a test, see your primary care provider, but we know that there's many in our community that don't have insurance or don't have a medical home. So what are we doing to help those individuals? Making sure there's expanded testing opportunities, and that's something that we're working on. And our partners, obviously, Dr. Izzard is here from Milwaukee Health Services, so he could talk a little bit about what they're doing as a federally qualified health center. And then looking at why the funding mechanisms are the way that they are. You see the surge of money that comes in during disaster, right? But what about before the disaster? So making sure public health is adequately funded so we can truly be efficient and effective at our work. I mean, the Milwaukee Health Department, we're still trying to get an electronic health record, and it's 2020. This is something we should have had years ago. And that slows us down when it comes to being able to process data and coordinate with the systems in our area related to patient care. And of course, investing in the communities. So setting the community up to be able to sustain itself and not have to be saved by another entity. Because we know grant money is great, but it's only for a short amount of time. So we want to create some type of equity and capital in our communities. Lastly, I want to highlight that starting tomorrow is National Black Maternal Health Week. And this is sponsored through or organized by the Black Mamas Matter Alliance. And this is important to note, because as we're seeing how COVID-19 is moving through our communities, that there was already this movement about breastfeeding, birth workers, midwifery, doulas, and the like, to promote better birth outcomes, to reduce infant mortality and maternal mortality. So again, just want to highlight that this is starting tomorrow, and there'll be a number of features online using Twitter and Instagram and Facebook, just to bring people together to learn more about ways to bolster and promote Black maternal health. Thank you.
Thanks very much, Commissioner Kowalik. Next, we're going to hear from Dr. Jesse Ehrenfeld. Go ahead, Doctor.
Thank you so much, and thank you, Commissioner, and thank you to the team for having me as a part of this briefing today. I'm Dr. Jesse Ehrenfeld. I'm the director of the Advancing a Healthier Wisconsin Endowment that lives at the Medical College of Wisconsin, and I could not be prouder than to have been able to step forward to provide nearly $4.8 million in funding to 17 critical projects that will reach out and touch highly impacted, vulnerable populations and address some of the urgent needs in efforts to minimize spread of COVID-19. And this is a part of our fundamental commitment as a part of the Medical College of Wisconsin to protect the health of the residents living statewide. And for us, this is kind of unprecedented. The typical time frame for us to get grants out the door is frankly around 6 months. We got this done in under 4 weeks, and this funding is a part of a collective response that we're seeing across the county and the state to support action that we know is critical to protect health and save lives. So what I wanted to focus on is the grant that we gave to the City of Milwaukee Health Department, $500,000 to rapidly improve communication of prevention guidelines to communities of color living in Milwaukee County. And a lot of the work is going to focus on piloting online training for community health workers to be able to respond to some of the growing behavioral health needs among those communities. We know that mass crisis communications that do not tailor their messages simply fail when there are cross-cultural differences. And so this project is going to be critical in making sure that these highly vulnerable populations that we've been talking about today are addressed. I'll just give one other note. There's another project that's also a partnership between the Medical College of Wisconsin Institute for Health Equity and Milwaukee County, about $145,000, a great collaboration to help develop dynamic and responsive epidemiologic data to allow those projections to be used by the county. We think that this will be another important step to allow health experts here today, other leaders, to respond in real time as the pandemic expands. Finally, we are a statewide philanthropy, although we do live here at the Medical College of Wisconsin. And there are a number of other grants that are also addressing other highly vulnerable populations we're very proud to have made, including grants to address needs in the Native American population around the state, our transgender communities here in Milwaukee County, and some of the migrant and seasonal workers in other parts. Thank you so much.
Thanks, Dr. Ehrenfeld. Next, we're going to hear from Mr. Reggie Jackson, who's the head griot of America's Black Holocaust Museum here in Milwaukee. Mr. Jackson.
Yeah, thank you all for inviting me to be a part of this. I want to just start by taking us back 50 years when the African-American community in Milwaukee was actually doing pretty well. We had the 7th highest median family income for African-Americans in the country. Our poverty rate was about 22% below the national rate for African-Americans. And over the last 50 years, we've seen a complete reversal of fortunes. A long history of segregation policies such as redlining, the use of racial restrictive covenants, which kept people of color, in particular African-Americans, out of our suburban communities. When we look at home ownership rates here in Metro Milwaukee, the home ownership rate for whites in the area is about 68, almost 69%. For African Americans, it's less than 28%. We have a very mobile community. People are constantly moving. A great deal of evictions taking place. When we think about some of the social determinants of health, I've heard Dr. Israel say this on multiple occasions, that they're really economic determinants of health, because when you have high levels of poverty, the African-American poverty rate in Milwaukee is higher than any other major city in the country. Our unemployment rate is nearly 3 times what it is for whites in our community. A long history of the loss of really high quality jobs, those manufacturing jobs that brought my family to Milwaukee in the early 70s were very present. In 1970, there were 100,000 of those jobs just in the city of Milwaukee alone. Today, there's only about 27,000. And many of those manufacturing jobs now are out in our suburban communities where people don't have access to those jobs. And because of the continuing policies that are in place preventing us from moving out to our suburban communities, we only have about 7.5% of all African Americans in Milwaukee County actually live outside the city of Milwaukee. So when we look at that map that the county has showing where these cases are and showing eventually where the deaths are, you know, we're not surprised. Those of us in our community, we're not surprised to see those things. We have to understand that in our community, because of the lack of high quality jobs, people have not had access to medical care. You know, we had St. Michael's Hospital close a number of years ago. We've had a lot of clinics in our community that closed. You know, the hospital that my wife was born in, Northwest General Hospital, does not exist anymore. So a lack of access to healthcare. A lot of people who had jobs that didn't provide healthcare. Prior to the Affordable Care Act, there were a lot of people who didn't have access to healthcare. And those things led to people being unhealthy. You know, much higher rates of hypertension in our community, much higher rates of asthma, much higher rates of diabetes. And we know from the studies that have been done in the United States as well as some other countries that if you have some of these underlying conditions, if you do get the virus, you're much more likely to die from them, and you're much more likely to suffer you know, more severe illnesses. Even if you survive the virus, after you survive, you're still going to have issues with people having problems with their lungs for the rest of their lives in some cases. So as we look at where we are today, we have to contextualize and understand that where our community is and the issues that we're dealing with the disparities are not something that happened because of something that we did, because we were not people who valued education and didn't want to work. These are things that are a pattern of disinvestment in the African American community over a period of many, many decades. The loss of high quality jobs that now force people to work service sector jobs. You know, we talk a lot about the people who are working, you know, in the grocery stores and other places, but one aspect that we're not talking about are people who are cleaners that are at the hospitals, that are cleaning up behind, you know, the sick people at the hospitals. You know, the doctors and nurses aren't doing the cleaning of the hospitals. We have very poor people from our community that are working in those spaces. We have very poor people from our communities that are going to other businesses and cleaning. So there are a lot of people that are impacted. And one last thing I'd like to share when it comes to this idea, I've heard a lot of people say that people in our community are not practicing social distancing. There are a variety of factors that people can't necessarily do it. As several of you have shown earlier and talked about, you know, people don't have access to work from home. And another thing, you know, when we have elderly people in our families, a lot of times the younger people are caretakers of those people. So they have to travel from their home to their grandmother's home and their grandfather's home to take care of them. And studies early on in China, data just came out last week, showed that each person that contracted the virus early on eventually shared that virus with almost 6 other people. So we're going to see continual growth of this within our community. And it's not because people are irresponsible and not socially distancing. It's because the circumstances don't allow them to work in a space that's safe and don't allow them to be able to work from home. And we have a lot of work to do. I think that once we kind of get higher numbers of this, I think people are going to take it more seriously. I've seen a growth in people taking it more seriously in conversations I've had with people. But I think there's still a lot more information we need to provide with people, factual information, because people are getting information from social media and are really running with that. We need to be much more adept at providing the type of information that will keep people safe, and also making sure that our institutions do not continue the practices and policies that have led to these disparities over a number of years. You know, we started work on, you know, addressing these issues with training of county staff last year, but we still have a long way to go. And I'm hoping that as we move forward, that we continue to work together as a community and recognize that a lot of people are hurting, and that in particular the African American community, with 2/3 of the deaths so far, that we really need people to provide resources that we don't have available to us right now. And to not point the finger blame in our community, instead reach out and provide the services and the assistance that people need, because I'm hearing this from people on a daily basis. We need more help. We don't need people blaming us. We need people helping us. So thank you all, and appreciate listening to the comments earlier, and I hope to be a part of this moving forward, the work that we're doing to address these issues, not just now because of this pandemic, but the issues that have been issues we've been talking about in our community for decades. There's a lot of work that we need to do that we haven't done, and we need to be more proactive about it moving forward.
Thank you so much, Mr. Jackson. The next speaker is Nicole Brookshire, who's the director of the Milwaukee County Office on African American Affairs. Director Brookshire.
Thank you, Brian. Thank you, Reggie. Perfect segue into kind of what should be next steps, what are our needs, and how do we come together to outline those and then again come to a call of action. While we know that the pandemic is definitely not over and we still, from Milwaukee County, have not reached our peak, we do know that things can't start happening now. We do know that we need the voice of community. And so what was and has been shared to date is where we're starting, but we cannot do this alone. And so to Reggie's point and to others that have already highlighted, and I'm sure will follow up after me and provide even more, the targeted messaging that is part of the grant that comes through the AHW Medical College of Wisconsin in partnership with the health department is one effort to target the communication. Right now, we want to know and have a voice of our youth. How do we best identify what can reach you and what resonates and sits with you? And so from that matter, there will be a small focus group. So I'm asking outwardly, if there are youth who want to have their voice heard, it matters. We want your voice to be heard because with your voice, we can make change. And now is the time. If there is an opportunity for you to reach out to my office, to use the main website, stayhomemilwaukee.com, and provide your information, we'd like to pull together that information and bring in a virtual, for social distancing purposes, a virtual focus group to start asking these questions of our youth, but also doing that in different ways across our community. We want to reach the youth now because we know they have innovative means that we may not think of. And I maximize on those opportunities. But when I say a call to action for community, I'm also reaching out, asking for community partners of where we sit for solutions. What is working well, what's not? We're hearing a lot of rumblings about the food insecurities right now. We had food deserts, to Reggie's point, before the pandemic. Now it's getting worse in the targeted areas where the cases are increasing. How do we solve for that problem? How do we again go back to old school ways, excuse my French, of really helping each other? Community is what's going to get us to moving forward and having healthy lives because everybody's voice matters. Our community voice matters, your individual voice matters, and we need that now more than ever. If you can reach out to my office, if you can reach out and provide your information at the Stay at Home or Stay Home Milwaukee, MKE.com website, we greatly appreciate the opportunity to really be able to pull together the voice and really synthesize how we can create strategies and create tangible items now while we continue to eradicate the pandemic. To highlight briefly, almost a year ago, we declared racism as a health crisis. At that time, we never knew we would be facing a pandemic 12 months later. The intentionality of declaring racism as a health crisis is to ensure that we make change institutionally and we transform our government because we know the role that government played in creating these inequities. We know it's going to be a long process, but again, we cannot make this a solution that's equitable without community voice. So I champion everybody today, our community stakeholders, our corporate stakeholders, our philanthropic partners, to help support this work. And some of you have already come to the table, so thank you. My hat goes off to you. Lastly, I'll leave with, I have to pay homage to all of our healthcare workers, but also our frontline essential workers that are continuing to go work every day and put their life in jeopardy, because I appreciate you. You're helping save someone that I love. Thank you for your time, and I'll pass it on to Dr. Tito Izzard.
Thank you. Next, we're going to hear from Dr. Tito Izzard, who's the President and Chief Executive Officer of Milwaukee Health Services.
So thank you. Thanks to the mayor and county executive and to all of you for taking time to participate in this discussion. We've had so much great data and health information provided. I don't need to focus on that piece. So I'll talk a little bit about what the federally qualified health centers do in our community and throughout the whole United States and across this country. Federally qualified health centers are independent, not-for-profit organizations that are here to serve the community and to make sure that no one, regardless of your ability to pay, goes without access to high-quality health care. And so within probably just a few minutes of wherever you are in the city, you can find a federally qualified health center where you can go and receive all the primary care health and other related services that you may need. So our organization, along with our sister clinics, are committed, especially during this time, to make sure that anyone in our community that is unattached, meaning that you don't have a primary care provider, that we're here to be able to serve you. And feel free just to reach out to all of us, and we will make sure that you're able to get connected to healthcare. We'll also make sure that our patients who are at risk for the COVID-19 virus, also that we're able to ensure that you're properly assessed, and to make sure that we can do everything we can to ensure that your testing is available to you. Now, for everyone else that has primary care providers, we encourage everyone to take the time to touch base with your clinic to make sure that you have your 90-day supply of medications and to make sure that you're doing everything you can to stay healthy. But lastly, I'd just like to comment about the consequences of what's going on, since we talked about the racial and ethnic disparity that exists within this. Well, when we look at stability, stability is really the key measurement that is missing. Well, because when you think of it is your wealth position, that it's your wealth position, not your income, that stabilizes you. And when we look here in Milwaukee at the African American community, the consequences of the lack of wealth, which goes back to our lineage in this country, that is what results in the instability of our physical health, the instability of our behavioral and emotional wellness, the instability of our social situation, the instability of our financial or economic situation, and the instability that may express itself spiritually. So when you think of the consequences of instability, well, what ends up happening is that instability creates dissociative behaviors. And how that plays out is we will see that an individual who is unstable in one of those 5 manners I just described, when someone is unstable, they are more likely to make decisions that are contrary to their own faith, their belief, their morals, their values, and their character. And so we have to ask the question, well, then what do we do when we're dealing with people who are unstable in some manner? Then really, if you think about it logically, we all know that lots of studies have already shown that when a person is under a stressful or crisis situation, they are less likely to think linearly or logically, okay? So we cannot reach the whole community and just use facts and data and logic and assume that everybody's going to do the right thing. This is the time where leadership really becomes important in a crisis. When there are unstable conditions and people start to act in a manner that's dissociative, meaning in a manner that's inconsistent with how they normally would act, instead of having leaders who are just present, this is where credibility becomes a big key component. And when working with the African American community, the disconnect between previous leadership and what's happening at the grassroots level, there is a disconnect. And so in order to truly reach out to the people who are most impacted and affected, we have to ensure that when working with the most vulnerable populations, whether it's the African American side, African Americans on the north side, or the Latino, Latinx community on the south side, or the Hmong community, or whoever, the Native American populations, we have to remember that when you work with those populations, you have to ensure that, number one, that community gets to select its own leaders and to make the self-determination of that community present. Number two, we have to ensure that there's a process of continual leadership development within that community, because over time, we have to make sure that someone is there to pass the baton to. And number three, we have to ensure that the grassroots organizations are being connected with so that they can build their capacity to serve. So what do we need to do now? What we need to do now is to have our leaders ensure that they're reaching out to all the impacted and affected communities, and make sure that the level of credibility is there for the message to be heard. And at this point, when people are under a stressful situation, they're going to look to not who their leader is by a title, but who has the most credibility. And that credibility really will be the people who've been in the neighborhoods, on the streets, in the clinics with them. So the value of the community health centers is not just what we do in the four walls. The value of the community health centers in our community is that we work with all the people we're referring to. And what we will look forward to is listening to them to help us with the strategy to make sure that no one is turned away regardless of their ability to pay for healthcare.
Thank you so much, Dr. Izzard. Next, we're going to hear from Supervisor Felicia Martin of the Milwaukee County Board of Supervisors representing the 7th District. And Supervisor Martin, there you go.
Good afternoon, everyone. Felicia Martin from the 7th Supervisory District here in Milwaukee. In our district, we know that we have been hit pretty hard with the COVID-19 virus, if we're all following the dashboard that is available on the Milwaukee County webpage. And I encourage everyone to take a look at that. I wouldn't look at it every day because it will be depressing, but at least twice a week, take a look at that information on the COVID-19 tab, and you will see some pretty startling information that many of us in the African American community is well aware of, as previous speakers have stated. I'm here today to encourage our citizens across all spectrums to please respect the social distancing guidelines, recommendations that are being put forth by our healthcare community in accordance to the CDC guidelines, and don't congregate in groups in public spaces such as our parks, our basketball courts, and our playground areas. It is so important for social distancing to be happening because it helps prevent the spread of the disease. The 7th District has had several deaths already, and my goal is to connect with as many constituents as possible, helping you to understand how we all are in this together, because we surely are, and all of us working together, we will get through it together and be supportive. We have to get back to that old African village of sustaining one another and supporting one another, and not being responsible for each other, but recognizing our responsibility to each other. And we want to make sure that we are washing our hands frequently. Even when you're in your home, in your self-isolation, you still want to continue to wash your hands frequently throughout the day. Remember not to touch your face, and wear a face covering of some type. It could be a standard mask if you have access to them. If not, do a self-made, a homemade face mask so that you are protecting yourself and those around you. Because we know if we have respect for ourselves, we then have respect for our neighbors and our friends and our community. We want to make sure that we all are paying attention to our mental health and the health of those around us. We want to make sure that we're connecting through social media, texting, and FaceTime, and so on and so forth, so we don't lose the social connectivity that we all require to stay mentally healthy. And please reach out to those resources that are available in our communities. Again, we have resources listed on our webpage, milwaukeecounty.gov. Please take a look at those resources so that you can have a holistic approach to staying well during the stay-at-home order issued by our governor. And I want to ensure and encourage everyone to know, like the county executive Chris Abley stated at the onset of this panel, that at the county, we are looking at these racial disparities. We are putting forth a racial equity ordinance along with the administration offices and the Office of African American Affairs and the County Board of Supervisors. We are all so committed to this so that we don't have the numbers that we're seeing. We want to make sure that this is not just a short-term endeavor, but we are all committed and in this for the long term. And we will continue to work on this in our next term coming up and working on these racial inequities throughout our community and making sure that internally we are not only just doing the training, but we're not only just having an educated knowledge about it, but we're actually putting it in action. We will walk the walk and we will hold our partners and those that we contract with to the standard of addressing racial inequities. This is something that cannot go unanswered anymore. This is the time that we have. This is a clarion call for everyone to look around and address the inequities and the racial disparities, as well as the socioeconomic disparities throughout Milwaukee County, and not only just Milwaukee County, but throughout Wisconsin and around our nation. And we're asking everyone to be committed, to be responsive to each and every one of us, and that we're all linked hands and that we're all together so that we can get through this on the other side, come out stronger and better than ever before, and committed to making Milwaukee County one of the safest, strongest, and best communities and healthiest communities in the state of Wisconsin. Thank you, Brian.
Thank you so much, Supervisor Martin. And I just quickly wanted to draw folks' attention to the chat, the group chat. A couple folks have dropped some links in there. I just put in a link to that racial equity ordinance that was recently proposed by the county executive and several county board supervisors. If folks want to look into that racial equity ordinance in more detail. We've almost come to the end of our speakers list, and I'm noticing that people are starting to put their questions in the chat window. So if you do have questions, feel free to type your questions in there and we will get to those first. Next, we are going to hear from Wanda Montgomery, who is President, Village of Brown Deer. President Montgomery.
Good afternoon, everyone, and thank you, Brian. I want to just first say I appreciate this opportunity to speak to the Milwaukee community and to all of you who are on this media this afternoon. This has been probably, like many of you have shared, the last month has probably been one of the most challenging in my life, as well as probably everybody on this call. As I'm sitting at not my kitchen table, but at a table that I look at as, you know, being who I am right now. I'm the Village of Brown Deer president, but that's not who I am. I'm a nana, I'm a wife, I'm a mother, I'm a aunt, a sister, a daughter. And when I think about the impact that this pandemic has had on our community, and where Milwaukee has been identified for many years to be the worst place for an African American, this just highlighted it even more. This is devastating for our community. It's devastating for my family. It's devastating for the people that I know who've already been impacted personally. It's almost every day I see a name that rises up and I'm like, oh my God, I know that person. And I'm constantly praying and seeing what I can do to impact or make a difference in my community, in Brown Deer, in the Milwaukee community, and the community in which I live. And so when I think about that and what I can do, you know, we talk about social distancing. I'm a person that I sometimes I feel like I'm a social butterfly because I enjoy connecting with people. I enjoy hosting things in my home. But because it's important right now for us to be socially distanced from each other, not socially isolated, it's important for us to share that message. And so I've been staying at home. I have the ability to work from home. But what I'm also able to do is to share my resources with people. It may not be tangible, but what information can I share? As Supervisor Martin talked about, places we shouldn't go or congregate. I enjoy going to church, but this is not the time for me to congregate at church. Our church has set up a Facebook Live page, so we're able to have our Bible study. We have a phone prayer line. We have Facebook Live for our Sunday service. So there are ways that we can do it. And sometimes people may not have access. So how do we help those people that don't? How can we maybe help them? They may have access to a computer, but maybe not know how to access those mediums. So one of the things that I've done, even recently, I used to be a sewer many years ago. And when they talked about face masks, I couldn't go to the store and buy a bunch of material and all of the things that we needed to do. So I looked at what I had in my home, scraps of material, and I'm up to almost 50 face masks that I'm gonna make sure to get out to my family and friends and anyone else. I'm not selling anything, but what can I give to the community to be able to help? And with that, I learned this week that it was a 10-year-old girl, her name is Lauren, and her grandmother said, I think my granddaughter might be able to do this. And she called me and said, I'm trying to make some face masks. What do I need to do? And I was trying to explain it to her over the phone. She didn't understand. I said, I tell you what, I'll do a video. So I did a video and sent it to her to give her those instructions that she needed. 10 years old. So it's all of us working together. We may not be physically together, but how can we get the message out, and how can we share what we know so that that next generation can learn from us and be able to spread that information. As I said, I'm a nana, a grandmother. I have 2 grandchildren here in town that I have not been able to hug, that I used to be able to do that every day. I haven't been able to do that. So, but for me, what we need to do short term in order that we're here long term is to social distance ourselves. Be in a place, be safe at home. If you can't be safe at home, there's a website you can look to see what some options are, and that's www.safehomemke, Safe Home MKE. With face masks, Supervisor Martin talked about things you could do there. You can make them out of a t-shirt, you can make them out of a bandana or scarf or handkerchief. If you must go out, washing your hands constantly. We want to make sure that when this subsides, that we're able to come out and really enjoy our family, our friends, and our community one more time. This is not the end. It's a circumstances we have to deal with right now. And so if each one of us plays our part, I think we can get through this with the help of each other. So with that, safe at home, wash your hands, wear a face mask when you're out, and I look forward to seeing all of you. I'm a hugger, so I can hug you the next time I see you. Thank you.
Thank you so much, President Montgomery. So now we're going to move on to questions, and I have just a couple of questions in the chat window. First one is from Jacqueline Ward, and she asks, where and how accessible is unencumbered testing? And that question may have come up when Dr. Tito Izzard was speaking, I think.
Okay. Well, if we're referring to unencumbered testing, meaning being able to test everyone. So it's important for our community to really understand this for quite some time. There is a difference between being tested by your healthcare provider to actually diagnose you and versus a screening test, right? This is not the time for screening tests. Because as everyone is aware, there's a national shortage on various supplies related to the actual testing kits. So at your doctor's office, when we do the sample collection, only someone will undergo that process if he or she has symptoms in addition to an assessment of their overall risk factors. And that conversation will happen with your healthcare provider. And so what are the risk factors? So the risk factors are going to be and of course, having this conversation with your healthcare provider or whoever you call, if you call one of the hotlines. But in general, we're looking for someone who has any type of chronic health condition like chronic hypertension or chronic cardiovascular disease, chronic lung disease like asthma or emphysema, someone who may be actively in cancer treatment or be immunocompromised because they're on various medications, even medications for your rheumatoid arthritis may cause immunocompromise. Sickle cell is in our community. And so those type of things. Others like that may have diabetes. So make sure you talk with your healthcare provider. One thing that I'm trying to promote more so that we're all asking that question is, are you an essential worker during the stay at home? Because if you're an essential worker, you're in the type of work, if you're a cashier and you have the risk of getting a lot of exposure, and now you have symptoms such as the fever, positive cough, may have some other respiratory worsening, shortness of breath, those type of things in the context of a person who's an essential worker will be extremely important. So what is happening now at a number of the testing sites throughout our city is, as we get access to more of the testing kits and as the labs are able to do more of the tests because they have more of the agents to be able to run the tests, we're starting to see that more people will receive what's called a diagnostic test. Diagnostic means to diagnose, right? This is not the opportunity to do screening, meaning, hey, I don't have any symptoms, but I might have been 50 feet away from someone who I think was positive and I just want to be tested to screen. That is a screening test that may come in the future, but now is not the time. So I encourage everyone to make sure that you allow all the existing tests to be used for those who are high risk as well as and symptomatic, so that we can make sure that we can do early identification, isolation, and then allow the health department to do the contact tracing, meaning anyone that you might have been around near the time you start to develop symptoms.
Thank you. Commissioner Kowalik, did you have something to add there?
No, I think Dr. Iser clarified the whole situation very well. Even medically, when we say screening versus testing, and in the community, it's just testing. So the need to be able to clarify that's really important. If we had access to widespread testing materials, we could do community-wide testing, but we don't have that right now. So we're preparing to scale it up once those supplies come. But right now we're trying to prioritize who really needs the test, and that guidance is coming from the state. So they dictate what the testing criteria is looking like to make sure the people that are most at risk for complications as well as death are getting tested right away.
Thank
And
you.
so also I wanted to state, just to make sure that our pregnant families are aware too, if you are pregnant, then you are also considered high risk. And it's real important to make sure you get access to a midwife or an obstetrician gynecologist who you're working with, so that early diagnosis of your pregnancy, they can talk with you regarding things that you can do to stay safe.
Thank you. The next question I have is,
Brian, before we go to the next question, Brian,
go ahead, please.
I think Dr. Iser did a great job in explaining the screening versus testing. I want to be clear. I think for us right now, we are in the short term, and we've got to navigate through these very turbulent waters. But we also know that in order for us to come through this, if you look at those places that have been successful, they have had much more expansive testing. And I think it's important for us to continue to press the federal government and the state government and whatever private providers are out there to get more testing, because the more testing we get, the more we can identify those individuals who are positive, we can isolate them, and then we can track we can socially trace their interactions. That to me is a way, when I look at around the world and I look at communities that have been more successful, that's been a big part of it. So I fully support what Dr. Iser is saying. He's absolutely 100% right. But we also want to make sure that we are not losing sight that from a community perspective, we have to have more testing.
Well, and it's also important for people to understand that when we look throughout the United States and all the locations that's doing testing, even though we're trying to use the test for people who are symptomatic and higher at risk. At this time, only 1 out of every 5 tests that are being run is the person actually being diagnosed with COVID-19. That means 4 out of 5 people have symptoms and important symptoms, but it's actually not, at least at that point in time, the virus. So if we started screening too many people, we're going to miss out on those who really do need to know that they're positive, not only again so they can isolate, but also that your healthcare team and the health department can follow up with you to make sure that your symptoms don't get worse over the next few days. Now, one thing that we are seeing nationally is sometimes those first few days may be okay, and it's not until the second week of your symptoms where people start to develop worsening symptoms and extremely progressive, that literally within a day, someone could, what we call turn the corner. So we want to make sure that for the high-risk patients who have worsening of symptoms, those are the ones that need to get tested. And if those of us who are healthy and without any of those risk factors I mentioned, or who are young, under 60 years old, really you shouldn't get tested at this point, but you definitely should talk to your healthcare provider to talk about your risk factors and how you can stay well.
Thank you, Dr. Izzard. Okay, now I see that we have quite a few questions in the chat. So I'm going to try to move through these as quickly as possible. And if I could just ask folks who are responding to the questions to try to give succinct answers. And if we have follow-ups from the reporters, we can route those questions to you. So the next question I have is from Suzanne with Fox 6, who asks, is Milwaukee doing disease tracing among the most affected neighborhoods to determine initial sources of the spread? If so, can someone speak to how living conditions and structure of neighborhoods contribute to the spread among African Americans?
Yes, that epidemiology investigation is being conducted. As you saw yesterday, Chicago shared their first, like the track of the first person that was COVID-19 positive and how they infected other people in the community. And just by them going to a birthday party and a funeral, how they were able to infect so many people just by those 2 activities, which is why we have this safer at home order in effect right now. So we're hoping that we can get that level of information soon so we can share it. Because I mean, Sherman Park is where I grew up. I'm personally invested in knowing how COVID-19 has moved through my home community. But in general, just getting a sense of how this disease has moved through our community is very important for us just to have a sense of understanding. We have these orders in place that are promoting social distancing, isolation, things like that, which are very helpful, but just to be able to understand how this started is going to be important for us moving forward, as well as assisting with some of the conspiracy theories and doubts about how COVID-19 even got to Milwaukee in the first place.
Thank you, Commissioner Kwolek. Next question is from Emerald Mills. Can you provide information on what research is being done around understanding the virus? I would love to know where research is being done and what are the current advancements around understanding what the virus is and what can be done to prevent, cure, and eliminate it. It's a fairly broad question if anyone wants to.
I can just jump in. We also, as a part of the grants that we put out, did fund some efforts at Versatilles, the blood center here that's also affiliated with Medical College of Wisconsin, around treatment using convalescent plasma. There's been some promising results across the country and the world, frankly, about that approach. People who have been infected have antibodies circulating in their blood that can be then taken out and then given to other patients who are critically ill. And so some of that work will be happening here locally.
And that's obviously a very long way to really truly answer that question. So I just encourage people to look at some of the great studies that are being done around the world. But some interesting things that just to let people know. So the SARS-CoV-2 virus, which is the formal name, which we call the COVID-19. What's interesting is that we talk about it being a droplet, meaning that it's something that comes when we talk forcefully, when we cough, when we sneeze, and so it's a respiratory droplet, which typically will hit the ground by 6 feet. But so when we look at the size, just for the layperson to have a better understanding of of what the size of this particle is. And even though, if you think about the head of a pen, we always talk about, the head of a needle pen. Typically, you can have between 50 to 100 of these viral particles on the head of a pen. That's how small they are. So if you're thinking about just pulling up your sweater to cover your face and think that's going to protect you in an environment, that's not going to protect you. So if you're making a mask or thinking about using your clothing, anything that you can put over your eyes and you can see through it, that is not going to be good enough to protect you. So think about anything that's larger than the head of a pen, 50 to 100 of those viral particles could get through that. And so Dr. Anthony Fauci has talked about, as well as the US Surgeon General, Jerome Adams, Dr. Jerome Adams, they both have talked about the masks that we make, the self-made masks that we make are really helpful to protect other people from us, because as we talk and express through our mouths and through our nose, it prevents it from escaping beyond our homemade mask. Okay, so if everyone wears their homemade mask, we're protecting each other from ourselves. Okay, the medical surgical masks that we use in the healthcare environment, those should be used by the healthcare providers because of shortage, and that helps protect the healthcare worker, helps you protect you from the healthcare worker, but also helps protect our healthcare workers. And we cannot have a situation where our healthcare workers are out of commission for 2 weeks because of the infection, because people still get sick for other conditions beside the COVID-19 virus. So I thought that's very interesting for us to think about.
Thank you. Next question I have is from QC, who asks, is there a comprehensive plan? Is there a coordinating mechanism? And I'll just answer that second one real briefly. I believe the coordinating mechanism is the Milwaukee County Unified Emergency Operations Center. That's an intergovernmental body of elected officials and public health officials and medical professionals who are developing a coordinated response. But does anyone want to speak to the question of a comprehensive plan?
Brian, I've answered that in the chat. So
you did, okay.
And there's
Great.
a couple of answers in there already, but the Milwaukee Healthcare Partnership has been convening all of us to look at strategies for increasing access to testing. So there'll be some information coming out shortly that we won't be able to say today, but good news is on the way.
Fantastic, thanks. So from Rebecca Clough asks, the Medical College of Wisconsin today said there are less than a week of PPE left in this area. What can people do to help? What is the plan to get through the surge with so little supplies?
So we've said before, one of the things that people can do to help is donating PPE. So we're looking at new and unused masks, medical masks, surgical masks, N95 masks, gowns and gloves, and those can be dropped off at State Fair at 87th Street, I believe, at the Tommy Thompson Center, and that's 7 a.m. to 7 p.m., 7 days a week. In addition, we're working with our EMS systems, we're working with our frontline workers, we're working with our hospital systems to continue to monitor their PPE usage and continue to expand upon that supply.
The only thing I would add too is we gave several grants to scale production locally of PPE using 3D printing technologies and other approaches. And we think that these things will be helpful, hopefully, to many of our frontline providers, as well as EMS, police, and other personnel.
Okay, next question, and forgive me if some of these have been answered in the chat. We have a little bit more back and forth in the chat than we normally do, and it's hard, to scroll through everything and catch everything, but I'm going to do my best here. So the next question from Emerald Mills: the results of the high African American COVID-19 test results are creating additional fear, phobia, and stigma between whites and blacks. How do we promote and support those who actively build relationships across cultures during this time to fight these stigmas?
Brian, Supervisor Martin here. One thing we want to make sure that we are crystal clear on, we are focusing on the African American community because of the high numbers, but let us all be mindful that COVID COVID-19 does not discriminate across any line. We have this hitting throughout Wisconsin, throughout our nation, and people of all races, ethnicities, doesn't matter what age group you are, people are dying across all spectrums. So let us not focus so much on what is dividing us, but what brings us together. Just let us know that this is one disease that does not discriminate across any lines. And we're seeing people falling on a daily basis. And yes, it's higher in the African American communities. That's why we have to do the studies and look at all those racial disparities that contributes to that higher number among people of color. But we want to always remember our humanity and extend grace during this time that is difficult for everyone, because we are social beings. Well, most of us, some of us are not, we're introverted, but we want to be mindful of that we're all in this together. And we want to keep trying to bridge all of those gaps that continue to try to separate us.
If I could weigh in, well said, Supervisor. This is a pandemic. It's everywhere. And I think if you look at how we're treating this as a community, it's a test for us. Are we a community? And I was very disappointed when President Trump tried to attach this to a community in China, to divide us along those racial lines. That's not who we are as a people here in Milwaukee. And just recently I met with some Hmong representatives from the Hmong community, and they felt that they had been singled out because of those comments, and they felt that they had been discriminated against. The worst thing that could happen in this, in terms of the community, we know that there's a health crisis going on. We know that there's an economic crisis going on, but we can't allow this to divide us as a community.
Well, and I would just like to say that, be cautious and careful of trying to study something to death, when the reality is what we're experiencing right now, for those of us who've been working in this space, is extremely predictable, right? Because we've been saying this for years. Whenever you see this high level of health disparities and economic, as Mr. Jackson spoke on, when you look at the economic disparities that exist in our communities, none of us should be surprised of what we're seeing. We don't need to exhaust studies to try to figure out why African Americans are dying due to the coronavirus. We already have very good ideas of what it is. What we truly need is a true solution to addressing the economic disparity of why African Americans have been relegated to the permanent underclass in this country. And another thing, what we need to do is prepare for the second wave, which is the potential economic devastation that'll happen in our community due to the delayed recovery of our economy, and to make sure that African Americans who are already on the lower pay scale, and nationally 50% of African Americans have zero to negative wealth. So if you don't have wealth, how will you sustain yourself through this time frame? So I really don't need a lot of studies to tell me why African Americans are dying. What I need is a comprehensive plan at our local, state, and national level to address the economic disparities. That's the only truly way you're going to be able to address this and future conditions.
I'd like to add also that when it comes to, the conversations between different communities, I think there are a great many people in our white community in particular that aren't familiar with the lived experiences of people of color, particularly African Americans. We live in such a segregated community that people don't have normal contact with people from other communities. And as we have these conversations, just as Dr. Izzard just talked about, these aren't things that we need to study. We know these things. There's copious amounts of evidence of these things. But what's different, though, is that people outside of our community don't necessarily know these things. The average white person in the United States, a study that was done about 5 years ago, showed that about 75% of whites in the United States do not understand the difficulty of the lived experiences of African Americans in our country. And another similar study or survey showed that about 91% of whites in the United States do not have a single person of color in the circle of people that they have normal contact with on a day-to-day basis. So what happens is people from outside of our community make assumptions about our community, and you begin to hear people point fingers of blame without really understanding the historical context of why our communities are suffering the way that they are, without understanding the disparities that exist already before this pandemic started, and not having that information leads you to have conversations that aren't productive conversations, because you're not speaking from a point of understanding, you're speaking from a point of ignorance. And I think that, you know, we need to do a much better job as a community, and it's part of what my company, Nurture and Diversity Partners, did doing the training for Milwaukee County employees, is really making people aware of these things, because people don't know enough to have the right types of conversations. And so I think there's a lot more we can do in terms of sharing with our community overall these disparities, because we make assumptions that people know, and that's just simply not the case. People don't necessarily know about the disparities.
And it's also important that everyone remembers that asymptomatic people can also pass the virus on. So it doesn't make sense to be afraid of any one particular gender, race, or any other dividing component. Everybody has the risk of potentially contracting and spreading to other people.
Okay, thank you all for those responses. And so we are well over an hour here, which is great, because it indicates that strong level of interest in this subject. And we are committed to returning to this topic in future press briefings. I want to apologize to everyone who asked a question who didn't get their question answered today. But if you're a journalist and you have a specific question for anyone on this call, please feel free to email that to me, and we can follow up with you directly. Thank you all so much. I really want to thank all of our guests for taking the time to be here today and bringing your voices to this discussion. Thanks everyone, and have a great weekend.
Thank you.
Right.